I'm with two physicians who work at the Hypertension Clinic at St. Paul's Hospital. Why is it important to have a dedicated hypertension clinic?
I'll answer that question. I'm Laura Kuyper. I am a hypertension specialist and a general internist, and I'm the director of the Hypertension Clinic at St. Paul's. And I think it's very important to have a dedicated hypertension clinic because of the importance of this condition. It affects about 20 to 30% of all adult Canadians and is the most important risk factor for heart attacks and strokes, and therefore death in basically worldwide. It's a condition that can greatly impact people's lives and shorten lifespan, and is often very difficult to treat in our resistant hypertension cases where people require a lot of medications for blood pressure control. And so it needs really specialized care and often multidisciplinary care with multiple various interventions to control people's blood pressure and to provide good follow-up. So that's why it's really important to have a dedicated clinic where we have specialists who have extra additional training in hypertension.
And what services does the Hypertension Clinic at St. Paul's offer to patients?
And I'm Jane McKay, and I'm a general internist, also running a hypertension clinic at St. Paul's Hospital. One of the unique aspects of our clinic, having heard what Dr. Kuyper said, is the importance of the hypertension is that we can spend time with our patients. So when we see them in our clinic, we have the time to actually learn more about them, to learn about their history, to spend time going over diagnosis, treatment options, as well as appropriate investigations. It's an individual journey with each patient, and we're fortunate that we have a dedicated clinic that we can do this in.
And what would be some examples of some of the patients who you would see, some of the conditions they might have, and how would you treat them?
Well, typically we'll be referred patients from family practitioners or from the emergency room or from other physicians practicing in St. Paul's. They may be patients that have comorbid disease already, such as heart disease or kidney disease. And all of our patients are treated completely the same. They start with an initial assessment where they have an intake form that they fill out. They review their story with a physician, and all of our patients go through a fairly standardized approach to non-pharmacological management of their hypertension, such as diet advice, exercise advice, motivational interviewing, if needed to help them with caring for their hypertension. We provide them with individualized drug regimes that will help them. And also we give them home advice in terms of how to care for their disease once they leave our office. And those are some of the unique aspects of what we provide.
Fantastic. Thank you so much.